Today, we're going to dive into a really critical tension at the heart of modern healthcare. It's this intersection of powerful AI and, well, irreplaceable human clinical judgment. You've got AI offering this confidence in numbers, while nursing relies on judgment in context. So when they disagree, what's the right move? Okay, so picture this. You're on a shift. An alert from an AI-powered system flashes, flagging one of your patients for a high risk of sepsis based on their vitals. But when you actually go and assess that patient, your own clinical judgment, your gut, is telling you a different story. Maybe they're anxious, or their baseline is just plain different. This isn't some hypothetical. It's a daily reality for nurses on the front lines, and it really frames our entire discussion today. At the very core of this dilemma is a conflict between two ways of seeing. On one side, you have this clean, numerical confidence of an algorithm. And on the other, you have the complex, messy, and wonderfully human reality of a patient. Now, this slide here breaks down these two worlds perfectly. Look on the left. You see AI's confidence, which is built on just massive data sets and statistical probability. Its goal? To standardize care and reduce variability. Simple enough. But on the right, we have nursing judgment, and that's rooted in context. It relies on critical reasoning and direct patient assessment to respond to the unique complexity of an individual. Now, they're not enemies, but you can see they operate on fundamentally different principles. So to understand this a little better, let's first look at it from the technology's perspective. What is AI actually asking of clinicians? In one word, compliance. Yep, these systems are not built to offer, vague suggestions. They are designed to provide clear, evidence-based recommendations that are really meant to be followed. And this quote just brilliantly illustrates the mindset behind the machine. The goal is a noble one, right? Enhance accuracy, reduce inconsistencies in care. The system's logic is that by analyzing data from thousands, maybe even millions of patients, it can spot patterns a single human might miss. So the crucial point, from the AI's perspective, is trust the data. But of course, that's only half the story. Let's pivot to the other side of the equation and see how nursing judgment builds on this data by looking at the power of human context. Because while AI expects compliance, nursing practice absolutely requires context. It's the defining feature that separates real clinical care from pure data analysis. This quote from Dr. Pio is just fantastic. It perfectly captures the nursing ethos. Look, the data is a vital piece of the puzzle, for sure, but it's not the whole picture. The patient's story, their nonverbal cues, their family situation, that's the rest of the story, and it is absolutely essential. And this right here is the key function of the nurse. They are the human bridge. A nurse's critical thinking is what takes that raw data from the monitor and the AI, combines it with the human assessment at the bedside, and synthesizes it all into compassionate, effective care. So we have these two powerful forces, the data-driven precision of AI and the contextual wisdom of human judgment. How in the world do we bridge them effectively? Well, the answer isn't about choosing one over the other. It's about learning to avoid blind trust. Let's be crystal clear. Blindly accepting any recommendation, whether it's from a person or a machine, is dangerous in healthcare. When we over-rely on automated systems, we can fall into a really well-documented cognitive trap. And that trap is called automation bias. It's our natural tendency to just trust a computer's answer without double-checking the work. Think about it. It's like when you blindly follow your GPS even when the route just feels wrong. In a clinical setting, this can be so much more dangerous, leading to missed cues, diagnostic errors, or delayed treatment. So the key is to have a protocol. This trust but verify framework is simple, but it is incredibly powerful. Let's walk through it. Step 1, acknowledge the AI's alert. Don't just dismiss it. Step 2, go back to the source. Reassess the patient with your own eyes and hands. Step 3, analyze the discrepancy. You gotta ask, why don't these two things match up? Is the data wrong? Is there a new symptom the machine can't see? And then step 4, act. Act with your professional judgment, and just as important, document your reasoning. This completely reframes the entire interaction, doesn't it? Challenging an AI alert isn't being difficult or anti-tech. No way. It is the very definition of professional responsibility. It's your duty to the patient to be that final human checkpoint for safety and accuracy. And this leads us to the ultimate skill we need to navigate this new landscape: developing what we call informed trust. And that requires a new kind of literacy. AI literacy isn't about learning to code, not at all. It's about becoming a savvy end user. It means knowing what the tool can't do. It means recognizing that its training data might not perfectly match your specific patient's situation, understanding where that data even came from, and knowing when it's the right tool for the job, and, of course, when it isn't. This quote really drives the point home perfectly. I mean, think about it. You would never administer a medication without knowing its mechanism of action and side effects, right? So you shouldn't act on an AI recommendation without understanding how and why it reached its conclusion. This needs to become a core nursing competency, plain and simple. Ultimately, it all comes down to this. The future isn't about choosing between technology and humanity. It's about nurses who are skilled enough to use one to enhance the other. Blind faith in any system is just too risky. But informed trust, trust that's earned through understanding, verification, and critical judgment, that's the foundation of safe and effective care in the age of AI.